Thank you. I'm really pleased to be here. My background is in health and care, and the decision-making styles that we're going to be exploring I've been using in the context of self-managing teams, both in the organisation that I work as part of and as a trustee for a charity. But we're going to start by looking at the decisions that you're currently making. So I'd like you to think about, over the last week, could you think about 2 or 3 decisions that you've been either involved in, that possibly through a meeting, or you've made yourself. I am brand new to Jamboards. Joriam says it's easy, so I'm going to let Joriam explain how we're going to do it. But 2 or 3 decisions, just the content. So whether it was whether to recruit a new member of staff, whether it was how to dispose of a piece of furniture, or whatever it was in relation to your job that you're comfortable sharing. Over to you, Joriam.
Okay, folks, very simple. Just stay on the first page of the Jamboard. I put a couple of post-its here and there. Just right now is a very free exercise. Just try to remember a couple of decisions that you were involved this past week and add 1 post-it for each of those. Later, we're going to do something with those post-its, but for now, just brainstorm. I'm going to share my screen with the Jamboard just while you use it. And Helen, you just say when it's time to move on, okay?
Thank you. We'll just hold on for 2 more minutes to enable everybody, ideally, to post 1 decision, and then we'll move on. Thank you. Okay, thank you. Let's pause there. Matthew, would you mind giving me screen sharing rights? I'm presuming you're the host here. Thank you. Great.
Should be able to share.
Okay, I hope you can see that okay. So I want to introduce you to a really simple way of thinking about decisions. And that's really to think about them under these 3 boxes. Is it a decision for me to make by myself? Is it a decision that you make, somebody else makes? Or is it a shared decision? So let's go back to the Jamboard and see if we can move around the post-its that you've already put on under these 3 headings. So Joriam's going to show us how to do that. So please move your post-it either under mine, because it's a decision that you made by yourself. So I noticed one of them was whether to email the CEO or not. I'm presuming that's a decision that's yours and yours alone, or whether it's shared. So whether you're recruiting a new team member, is that a shared decision or is that a decision that's just yours? So let's get a sense from the decisions that you've made over the last week, which ones are ones you made by yourself, so please move them under mine, and which ones were made with other people, and we'll move those to shared. So I'll stop sharing and Joriam can take us back to the Jamboard.
Folks, just a thing, Jamboard only allows me to do one post-it at a time. We're actually working on page 2 right now, but I thought Helen would give me 5 minutes. She was too quick. So if you folks can just help me Control-C one post-it and put it on page 2 of the Jamboard, you will see that it has the 3 columns she talks about.
Thanks, Joriam. Does that mean that you're able to screen share again so we can see?
Oh no, somebody deleted a bunch of post-its. Oh, no, it's back. Oh, I'm confused. Does anybody know how to efficiently move all of them to page 2?
Shall we come back to that later then, Joriam?
No, it's fine. It's just just copy one post-it to page 2. That's all, and then position them under one of the 3 columns.
Joriam, you can duplicate Jamboard frames. If you go up to the navigation, the 1/3, drop it down so you can see the frame, and then in the 3 little dots, use the menu there to duplicate. That's the quickest way to make copies of frames within a Jamboard that I know of.
Thank you.
But does that copy the post-its? Oh yeah, it does copy the post-its.
Full content, yeah.
Grand. Okay, so I see a lot of people doing this. Let me do this then. What I'm gonna do is I'm gonna change the background image to this, because this is how I created this presentation. There you go. So the new page 2 now has the 3 columns and all the post-its. Good idea. Sorry about that. I was not that proficient. So now it's time for us to distribute those post-its in the columns below. We have a little bit too many post-its, but that's fine. Mine, yours, and shared. Find your post-it. It's there somewhere, and move it to the appropriate place.
Thank you. And will you share screen, Joriam, so we can see?
Yes.
Thank you.
Let me just delete the extra boards that we had and share my screen. There you have it.
Thank you. We'll just take one more minute to see if we can put them into mine or shared. Thank you. Excellent. Thank you very much. That's really interesting to see the decisions that are yours and the decisions that are shared. Let's look at this in a bit more detail now. So, Joriam, if it's right, if I go back to screen share. Okay. So I think it's critically important that in teams we are really, really clear about what decisions you're able to make by yourself. And one of them was who to go on going on holiday, attending these sessions. Really obvious that you'd make those decisions yourself. But there may be several that are in a grey area that you're not sure whether you need to get advice or information from other people or whether it needs to be a shared decision. So in the organisation that I was working with, called Wellbeing Teams, we wanted to make sure we were as clear as possible about how to make decisions within roles. So in our teams, we had the person and the family, the wellbeing teams that were directly delivering support through home care style work to individuals and their families, the wellbeing leader who is acting as a coach to the team, and then the national team. So one of the processes or ways of organising decisions that I personally think is helpful is getting really clear about where decisions are made. And for us, because we were a self-managing organisation, we were constantly checking whether the decisions that were in the wellbeing leaders list could be made by the team or not, and also trying to get decisions made by the team as close to the person as possible. So particularly when we're working in health and care, and particularly when we're focused on people having maximum choice and control, getting clear about the decisions that people themselves can make and then the teams around them can make feels an important thing to do. And actually for us in the team, made decision making much clearer. So that's one of the ways that we can kind of deconstruct how we make decisions into yours, mine, and shared. The work that I'd like to share with you next comes from the work of Samantha Slater. I don't know if you've seen this book. It's called Going Horizontal. It really is an excellent book. And in it, she shares this table here. And these are the different styles of decision making, some of which you'll be really familiar with. I think that in many organisations, and particularly my experience of health and care organisations, it's easiest to think that decisions are made in two ways, either in a very autocratic way by a manager or mostly by consensus, which often takes a lot of time. And the danger with consensus decision making is we are likely to go to the lowest tolerance for risk, because in consensus decision making everybody has a veto on whether the decision gets made or not. So if we just look at a couple that might be less familiar to you, so one is role-based decision making, and this is particularly advocated in holacracy, which is a style of working for self-management. And it means that we get really, really clear about which decisions individuals can make, that they don't need to invite others to contribute to. And obviously this is one of the fastest kind of decision making. So it's not based on hierarchy, it's based on your specific role. And in holacracy, roles have domains. So an example is, one of my roles in the national team is I'm the storyteller for the team. And the purpose of that role is to share stories and examples of how we've been working in self-managed ways. The domain that I have is LinkedIn. So that means that I can make any posts on LinkedIn whenever I want, related to the organisation without having to ask anybody else's advice. So that's an example of role-based decision making. And then the advice process, again, maybe one that not many people may be using at the moment, but that's where the decision might still be mine, but I want to make sure that I'm getting input from other people. So if you're out shopping and you want to buy a new item of clothing and you're not quite sure, you might send a message, a photo to a friend or a relative to say, what do you think? I'm thinking about this dress for this occasion. What do you think? So you're asking for advice, but the decision is still yours. And there might be, you typically would be looking at advice from people affected by the decision, and people with expertise. So when we look at the formal advice process, those are the two people or the two groups of people you'd be expected to ask advice from, but then you're still the person that makes decisions. The other one that I'd like to talk to you a bit about is the consent process and how that is different from consensus. So we use the consent process in our governance meetings. And what that means is it's a decision-making process. It's a collective decision-making process. But the purpose of this kind of process is to reveal whether there's an objection or not. Because what we're trying to get to is not consensus where everybody agrees and says that's excellent, I'm fully supportive of it, but is the decision good enough to try and good enough to test right now? So in holacracy, this process is used in governance when somebody presents a proposal and then everybody in the team gives their reactions to the proposal. We answer any questions for clarification, and then people have to say whether they've got an objection or not. But in holacracy and in the governance process that we use, there's only one type of objection that can overrule a proposal. And the objection is if you think this will set the organisation back or cause it harm. So that's one way of using a consent process. So if you don't think it's going to cause the organisation harm or set us back, then it's automatically approved. But another way of doing the consent process is simply asking, is there anyone who can't live with this? And that's another way of checking out consent. And that's different to consensus, where everybody has to fully agree. And as I said, anybody can veto the process. So that's the advice process, consent and consensus, and majority vote, I'm sure you're familiar with anyway. So it'd be really interesting to think about the decisions that you've been looking at and thinking about which might be the best process to use for that kind of decision. So we've got, this again is from Samantha's work. And she said that in chaotic situations where there's no time for involving other people in decisions, then an autocratic or an authority-led decision process can be used. And for a majority vote, in a way, that's really helpful to be used where speedy decisions made with quick consultation. She thinks that the advice process is best used when the situation is complicated and we need contributions from different people but still need to move fast. Consent when it's important that people are actively part of the process and a focus on action, and consensus when you need unanimous support. So I'd be really interested, Joriam, I'm deviating slightly from the script here, but I'd be really interested to see from people, perhaps using chat, about one of the decisions that you put on the Jamboard, and whether you think, based on the information I've just shared with you, what you think the best approach could have been for that decision. So if we particularly look at the shared ones, do you think, reflecting on how that decision was made, do you think another way of making that decision could have been more helpful? Let's see what people's responses are in chat. Yes, somebody's asked if we can see the listing in. Let's go back to the Jamboard, Joriam, and do it that way. Could you share that with us?
Page 3 of the Jamboard has all the names of those decisions, and also only the post-its with shared decisions that you left the time. I deleted all the ones that were either yours or mine. Okay. Brilliant.
Let's do it that way instead. So please move your sticky to where you think it could have been most usefully made. And if you wouldn't mind sharing the Jamboard again, Joriam, that'd be great. So if you drag your sticky, think actually here is this is a way that it may have been useful to make that decision. So not the way it was actually made, but whether another way of making it could have been even more helpful. So you can see several going to consent now and to the advice process. Okay, we'll give it one last minute for anybody to make some last moves. So given how the decision was made, is there a way that you think it may have been more useful or more helpful to make?
Cameron said something interesting in the chat. Said, on reflections, this has helped me determine that I've used an advice process to inform my next step to gaining consent. This is something that happens sometimes. The advice process has its own inherent rules, but truth is that you can ask for advice in any of those decision processes. It's just very important to be clear that in the advice process, who actually makes the decision. And but of course, you can always ask for advice. So even if this is not the decision-making process that's being used, let's say it's a role-based decision making, and you don't need to ask anybody. You might still benefit immensely from asking people.
Thank you, Joriam. That's really, really helpful. And you're right that the important, asking advice versus the advice process, the difference is the clarity about where the decision gets made. So if you're asking advice, it could be seen as part of consensus decision making, whereas really the advice process is my decision to make. And I want to get advice from people who've either got expertise or people who are affected by the decision before I make the decision. Thank you for doing this. In the work that I do, I very, very rarely use consensus decision making. And most of our decision making is role-based or consent. And I don't use the advice process formally in the way that it's often used, but in meetings, if it's my decision area, we use holacracy tactical meetings, and I will say, I'm about to make this decision and I'd just like to hear a round of advice or suggestions from everybody before I make it. But I think the more, for me, getting clearer about role-based decision making has been enormously liberating, because there's such a grey area of knowing whether it's my role to make the decision or whether actually I do need to ask people's advice. So the clarity around role-based decision for me has been really, really powerful. So I'd just like to share one last slide, again about decision making in Wellbeing Teams, and then we'll go to questions. So let me just share this one with you. So although I shared with you the earlier table to say what decisions we want to support people and families to make, what decisions the team made, what decision the team support made, the wellbeing leader and the national team, we know that not all decisions neatly fitted in those boxes, and we wanted to support the team to make decisions in team meetings without having to check with other people. So we together created this flowchart about decision making for the team. And at that stage, there was about 8 teams operating across the country. So the first question was, does this potential decision compromise our promises around delivering safe, compassionate, person-centred care? And of course, if it did compromise that, we couldn't make that decision. Then, does it compromise how we deliver our promises to our colleagues, which is our colleagues' well-being? And of course, if it compromised that, it was a decision that we wouldn't support people to make. And then, does it have an impact beyond our team? So I know that the teams could come up with great ideas that could affect all teams. And what we said that is it would need to have input from me or the national team before that decision could go ahead. But if it didn't connect with any of those things, our promises to people, our promises to colleagues, or impact on the national team, then people could, of course, make that decision together and test it out. So we recommended that if you're making a decision, you'd also agree a time to review it, or you might set it up as an experiment and take it forward that way. So I've been working on a product called Radically Good Meetings, and part of that is how we make decisions within teams, how we agree roles within meetings. So it's really thinking about meetings. I'm not a salesperson at all, but if you are interested in thinking about meetings differently in your organisation, please get in touch. It's on Teachable at the moment, and Joriam will post a link to that, and we'd be delighted to give you a discount as part of that. Or if you think you could help us spread the word to other people, we'd love to know how we could do a better job around that. But Joriam, you said it was important that we left lots of time for questions, so we've got even a bit more than 20 minutes. So please take us forward with our question and answer session. Thank you.
We're going to do the usual, folks. Just use the raise hand function on Zoom if you want to ask. Actually, I would like to invite Mary, who just asked a very interesting question a couple of minutes ago. Do you want to bring this question to the group?
Hi, everyone. Sorry, I've asked quite a few. So I was just reflecting on different kinds of decision making around the different areas, and my post-it was about my children because that's currently what I'm trying to organise. But if you're looking at teams, and within your team, there's teams that function really well and teams that function less well. And I just wondered, sort of looking at team dynamics, is there a team that uses, does a good team use more of one than the other, or is it just totally situation dependent in terms of, is it a stress situation or is it a team bonding forming situation? So what your thoughts were on that.
I heard that question going to the group, Mary, so I'll get started if that's okay and see if other people want to add to it. Sharon, Samantha Slade has got a view that if it's a high risk and a long duration decision, that those decisions are best made collectively. And that would be either together or with input from other people. And if it's a very urgent decision, and if we go back to that table that she suggested, that there may be other ways of making that decision. So her view certainly would be, it depends on the situation and how urgent and the impact of that kind of decision. I also know that teams that are moving towards greater autonomy and are choosing to do that, that testing out role-based decision making and consent-based decision making and the advice process may be new and different for them. So if a team is wanting to move in that direction, those may be new decision making styles that you might want to introduce if there was an appetite for that. But curious what other people's views are.
Come on, folks, don't be shy.
I mean, I think the only reason why I asked the question is because reflecting, like I'm a clinician, so I work in the NHS, right? And actually I work in a number of teams, and I've seen dysfunctional teams and functional teams, and the functional ones, I don't think medics have a real problem with decision making around their own roles generally. I think it's all the collaborative stuff and involving other people in decision making and involving each other in decision making. And so within that context, I think that the more consensus style of decision making that you have, even if it is very rapid turnaround, is helpful. And I've certainly used liberating structures in a bid to try and get that so that people can feel engaged, even if you're having to make decisions at speed.
Thank you. I'm an OT by background, and I think some of the role-based decision-making is really, really clear in the hierarchies of the NHS. And without that, I think it's very easy to default to consensus. But I think consent decision-making, can we live with this? Can we test it out? May not be used as frequently, and sometimes I think that can be very, very powerful.
Please go for it, Nigel.
Thanks. I put in the chat, one of the things, I've just started a new role, and you only get a chance to observe and get first impressions early on. But one of the first impressions I have is that there are groups that I'm seeing who are choosing not to make decisions and to escalate and almost project those decisions outside their decision-making process. Some of which I think should properly sit within their roles, if I'm honest. And so I wonder if you've come across that as an issue, because my impression before I joined the call today was how on earth do I work with these colleagues to try and make sure that the decision making stays at that appropriate level, and we don't just default to this I think rather unhelpful situation where actually colleagues are being asked to make decisions that they're not best placed to make?
I think that's such an important question, and I think it's particularly prevalent in blame cultures, where people are anxious about making decisions and that they might get blamed for them, and therefore push them higher up the organisation from that perspective. That's not the only reason why this happens, and I think that's getting clarity about, and it may be a process where you identify all the decisions that get made and can decide where they're most appropriately made, whether these are a bit like the table that I showed you before, are these decisions for a particular role? And if so, which role? Are these decisions for a particular team? Where does this decision have to get made? So I think there's a massive opportunity there for clarity in decision making, because I think that's a symptom of either lack of clarity of decision making or a blame culture where people are too afraid to make the decisions that should be within their role or within their team. Great question.
That's fabulous. Thank you, Helen.
Joe, want to go next?
Yeah, it's just in response to that, Nigel, kind of building on what Helen's already said, is it's thinking through about why that is that way, and is it because they've just got so used to it being so autocratic, top down, not necessarily blame culture, but just that they've lost the ability to make their own decisions, either through because they've been burnt, probably quite often, by making decisions that then are told off about, or don't really know, almost need to be given permission again that that's okay. And I think we saw a lot of that during COVID, that people were given permission, and largely that went quite well, actually stripping out all of this bureaucracy. So there's something about in this new world, not really post-COVID, but sort of, how do we not layer that bureaucracy back in and continue to create a safe way for people to try and to fail, but to fail safely and quickly and all of that kind of thing. So I think it's worth exploring a bit more as to why people aren't making the decisions, and then reflecting that even further in my own organisation at the moment is this idea that nothing can happen when the chair's not there. But actually we're just a group in the team. This isn't like this has to be done. The senior person has to be there, otherwise there's for one or two members, no point in me even turning up to the meeting if they're not going to be there, and that's not okay either. So there's quite a lot to unpack.
Joriam, do I go? Okay. Hi. So I've really found this session really, really interesting and useful, because it's my reflection in my role, my system role. So I work across West Yorkshire, the West Yorkshire ICS. And like Nigel was saying, there's a couple of things here. So in terms of that meeting and people escalating onwards, I think there's something there about knowing your audience, the right platform, the right forums to go to. It's about understanding what the problem you're trying to address and what kind of action are you wanting, what's the reciprocal kind of response that you're wanting, or appropriate response you're wanting, and knowing what the right forum is to take it to. So when Helen, you mentioned about those different decision-making styles, kind of resonated in terms of actually it's about what do you bring to that conversation, what do you bring to that issue, that wicked problem, how do you address it, and how do you engage at different levels. And at system level, because of that autonomy that's there, and you're trying to pull people together to work in a shared approach, that can be hard if you've not touched on the key thing that pulls them together. I understood what that key ambition or shared purpose is that pulls them together. But to achieve that as well is that you need to understand the complexities of the ways of working across the different systems or partners that are coming together. And that is all born from different cultures and different ways of working. And back to roles in terms of people actually feeling that this isn't within my remit, and I need to maybe potentially escalate that to somebody else to kind of answer that question, and then I'll bring that back. So sometimes quietness in the room might mean that people are less working overtime in their brains and thinking, actually, is that for me? Do I say anything now? Do I make myself accountable to this? And then actually someone's going to hold me accountable for this. And over time, people kind of, there's different behaviors that you feel that you see in a room that you think, actually, me reading this room is about me understanding that potentially they don't feel that they have the capacity or the power to influence the decisions. And then going back to the example, the autocratic majority vote, I love how that was broken down, because to achieve some understanding of consensus or agreement might mean for you to actually kind of understand what the issues are and get some deeper understanding of the reasons why people are not engaging. So, which is why I was want to put that note in the chat around how it's kind of reinforced my thinking about how I've gone about trying to get some consensus, but gone out to get to consult. But I love how you put the advice process to get some idea. But actually, I'm putting this out there. What's the feeling around this? I need to understand what's niggling in the background for why you haven't responded in a certain way. Does this make sense? What's the gravity behind this? And then actually, I'm the one that's leading on this, but actually I need to take this back with an understanding of the complexity behind this, and then I can seek consent and then potentially move towards consensus. But I need that consent to actually say, let's get on with this. So I've just been going on, but it just feels so real in what I'm experiencing at the moment. Thank you for that.
I think that's so important, because often when organisations consult with their communities or their constituencies, we're not clear whether we're asking for advice but it's our decision, or whether we're looking for a consensus, or whether it's a consent thing. So we've got this idea, but we need to know whether this would cause significant problems for people. So I think in public services we've been often not as clear as we could be, in a way that doesn't empower people to make decisions, or they believe that we've asked them to make the decision, but really we're just asking for advice and we're going to make the decision ourselves anyway. So I think getting clarity about what's the decision on the table here and how we're going to make it, and how we were then going to communicate, I think it's so important in any kind of work that's around engagement. Thank you.
Any more questions? Come on, folks. I saw some more questions on the chat. You're just not raising your hands. Come on. I see you. I see you. Helen, please. Oh, you muted. Oh, there you go.
My question is in relation to so say, for example, there's a group of healthcare professionals from kind of mixed disciplines. The purpose of them coming together is really around professional development. It's around knowledge sharing. It's around support. It's around maybe showing their own vulnerability in order to work through different pieces that are coming up. And as such, because it's professional development, it's kind of like closed. But then you have PPI or patient representatives who have an issue because they're not involved in that particular piece and feel that they're being excluded. And that to involve them would water down the actual. Well, first of all, there probably would be an initial issue with trust, and it would be tokenistic to involve, but it's how to kind of, it's how to have both sides heard and then move into the place of making the decision for what's the correct thing to do.
That's a great example, isn't it? And I think it's about purpose. What's the purpose of the group? What are the decisions that are going to be made by the group? And how are those decisions going to be made? And I think once that's really, really clear, then it's easier to have a conversation with patients or other people who feel like they could or should be involved around that. And then if people do want involvement, then the next question is what kind of involvement would work for both sides. I think it's very easy to believe that the only decision making that should happen in health and care is consensus decision making that involves everybody. And if we do that, that is likely to be the most ineffective way that we can organise ourselves. So I think it's about always having the question, you know, based on the purpose of this group or the purpose of this work or the purpose of this team, what decisions need to be made, what's inside our sphere of decision making, what's ours, back to the first slide, and then how are we going to make the decisions that are ours, what's our basic, so it may be that you have a sort of default decision making approach, or see on agendas now I would have, you know, what's the outcome, how are we going to make this decision, and how do we prepare for it. But I don't think we have these conversations enough. You know, what's the purpose? You know, what decisions get made here? How do we make those decisions? And I think if teams aren't clear about that, we then get into all these fuzzy and unhelpful places where things feel difficult.
Thank you.
Kristen, I don't know if you're there, but you had asked an interesting question about roles. I would love you to bring this forward to the group if you think that's useful. But first, Joe, you raise your hand again.
Yeah, it's just to build on that point that when we're setting agendas is to really categorize what's needed from each item. Partly this comes from a whole other piece of work, but around, you know, do we really start with the process of do we really need to meet? This is separate to this conversation, but actually if every single item on here is just imparting information, that can go in an email. So it's about being really clear about this needs a decision. This is, you know, there may be one or two items that are for information, just so that people, and that's explicit on the agenda and then almost explicit in the documents. I think for more sort of formal board papers and things now, most of them tend to have some form of front sheet, and it does tend to say those categories, but just thinking about that as a principle of when you are expecting decisions, and perhaps to again, for us as a good practice for if we're having a gathering, whatever that might be, that we prepare people for that they're going to be coming and there will be some decisions need to be made, and if there's things they need to think about, or that we're going to have a discussion or whatever the case may be. So that's just sort of triggered that thought for me.
I think that's absolutely right. I think the most radical agendas are, you know, what's the question we need to ask or the decision that we need to make? Who's bringing that and going to share information? So there's that ownership issue that Nigel raised. And then what's our process for making this decision? And here's how you can come prepared. And I think part of the reason it's hard to talk about decision making is because we're really talking about power. And power is something that it's uncomfortable to talk about in organisations often.
That's right, go for it. Kristen?
Oh, sorry. I think I couldn't figure out the reactions buttons. But I would really love, and I think this is actually another way at power, but I was thinking about, I was struck by your role, Helen, of storyteller on LinkedIn, and just what a discreet and very simple thing that is. And I see that a lot of the traditional, in the projects, a lot of the traditional power holders, like, it just goes back to like the boss needs to make the decision. So I would love if, like, in the chat, people could add if they see or use untraditional roles to try to help different people try on new things. And then maybe for Helen, you to comment a little bit more on what are creative ways to come up with very discrete roles that allow people to try to do some things that are clear but outside maybe of their normal way they're seeing. So it's kind of a both, like if people in the community would add what are some creative and discrete roles that maybe you have seen used, and then Helen, if you'd say anything more about
Be delighted, thank
that
you.
example.
would it be right if I talk while people are commenting? Because I'm doing this piece of work with a national organisation and their senior leadership team, and it involves, instead of, because if I asked you when was the last time you looked at your job description, I imagine it wouldn't have been very regularly. And the difference in roles and job descriptions is as you said, Kirsten, you deconstruct it into a number of roles with specific names, and then say, what's the purpose of this role? What are the accountabilities for this role? We also add, what are the metrics related to this role when it's done well? And what are the decision-making capacities for this role? So my role as a storyteller is, the purpose of it is to share stories and examples of the work that we're doing. The metrics are around how often I post on LinkedIn. So the expectation is it's one post a week. And we also talk about what happens when that's done well. Another of my roles would be maker, which is co-creating products that relate to our work. So I've got the role of maker. And another role that I personally have is program co-designer. So if a customer approaches us and wants a piece of work done, I would co-design the program with them. And again, it talks about what does good look like, how does it serve our purpose, and metrics around that. This deconstruction really comes from the holacracy work, and that's very much the way that works. But I think the only way you can get good role-based decision-making happening is if you've done the work on roles, first of all, and you've done the roles on accountabilities in roles. And you know what? It's incredibly powerful to have a table that says, here's what my team can trust me for. So these are the things that I'm responsible in my team, and here are the decisions that were made related to that. And for me, that goes to Nigel's, that's one of the solutions to the dilemma that Nigel raised about how do we support people to make decisions that are appropriate to their team or roles. Well, first of all, we've got to start off by being really clear what their roles are. And can I just add, so one of the senior leaders that I was working with in this organisation, as we did this work, she said, this has helped me realise that what I do is attend meetings that other people have put in my diaries, as opposed to being really intentional about my roles and how I execute them in the organisation.
No, you mentioned something about role reversers on the chat. I'm not sure what's that. Do you want to expand this a little bit?
Yeah, so I think it's a bit of an extension of I think what Joe was saying. So essentially, we set up so you do it anyway. I think when you're in your day-to-day practice, you might say, right, why don't you do chair this meeting and I'll watch, or whatever else. I mean, I think most people will have had experience of that. But we set up with the young. So I'm a paediatrician, right, and we set up a training kind of. It's a co-produced sort of model with young people, some of them in sort of previous patients, some of them not, and they basically we set up a series of scenarios where we run it as training for healthcare professionals, where the healthcare professional will play the role of the young person plays the role of the healthcare professional, and they run the simulation and then debrief and run it back. And it's just really powerful because actually you can't argue with lived experience, and I think it is really interesting the way the young people's perspective. I mean, it's just brilliant and game changing for a lot of people that go through the training. So I think it's just using, and I think in the same way, and I know I have shamelessly plugged for the RQ exchange thing, but actually it's around that whole involving the parents that know the child in the decision making and making them the key decision makers. And I think, please stop me talking, but I think if you go off on a tangent, you can see that now decision making around healthcare is not how it used to be. So, 20 years ago, I'd be the doctor, and now there's mugs with, Google it or whatever, that whole thing, but actually people have a lot more information at their fingertips, and a parent of a child with a really rare complex disease will know much more about it than I will as the treating clinician. So I think that decision making needs to reflect. And you talked about power in decision making. Actually, I think sometimes the power is very much in the arena of the patients and their carers, where it didn't used to be. And I think sometimes in our systems we struggle to catch up with that.
I think that's absolutely right. And I love the example about the appointment and having adolescents in the appointment and the consultant. And we've worked with people who use our services to help appoint colleagues. But again, it's being really, really clear. Are you here to give us advice and we'll make the final decision? Or are you equal decision makers with me, you know, in the decision that gets made? Or is it consent, you know, that you can veto somebody that you think would be unsuitable, but it's still my decision? So I think in the realm of co-production, which is so, so important, we still need to be really clear where the decisions get made. Otherwise, it's easy so if you invite me to be part of your decision-making panel, I need to know beforehand whether I'm giving you my advice or I'm an equal decision partner maker with you. And I think sometimes in co-production, we know it's the right thing to do, but it's sometimes still hard to have the conversation about where will this decision get made and what's your role in making that decision.